Hi, and welcome to the Brighten Heights Vitality Series, episode 3, which the topic is, why should you care about your health right now? And so first of all, I want to tell you that we are sponsored by the Brighten Heights organization. That's a community that's going to be developed in Pewee Valley, Kentucky. We plan to have residents be opening for residents in 2024. And our focus is going to be on empowering residents to prevent and reverse chronic diseases and live a life of purpose with vitality. So with that, we'd like to let you know that you can learn more about Brighten Heights at the brightenheights.org website. And specifically, if you want to receive more information about Brighten Heights and upcoming webinars, just go to the website and there's a place for you to enter your name and email address, and we will have you on our list. In a moment, I'd like to introduce our guest, but just a few housekeeping items. First of all, if you have any questions, just enter them into the chat window, and Katie will be monitoring those questions and asking them for you. And then you can also, if you're on Facebook Live, you can enter questions in the comments section and she'll monitor for those as well. My name is Susan Pena, and I am part of the team that is working to bring you Brighten Heights. Now I'd like to introduce to you Scott Edens, the president of Potential Living. Would you like to say hello?
Thank you, Susan. Hello, good afternoon. I am Scott Edens, and Potential Living is the sponsoring non-for-profit organization for Brighten Heights. And we're real excited about leading senior vitality. And with these webinars, it's our goal to kind of impart knowledge that will hopefully incline your hearts to take positive action. So thank you, Susan.
All right, thank you, Scott. Next, I'd like to introduce to you Dr. Wes Youngberg. I've given his background on our other webinars, but just to real briefly give you his background, he runs a clinic, a lifestyle medicine clinic in Temecula, California, and focusing on lifestyle interventions to help people with chronic conditions, and very focused on helping people prevent and reverse cognitive decline, more specifically. He is also a assistant clinical professor at the Schools of Medicine and Public Health at Loma Linda University. He's a fellow and founding director of the American College of Lifestyle Medicine, and he's written 3 books entitled Goodbye Diabetes, Hello Healthy, and Memory Makeover. He regularly speaks and writes publications on these topics. So welcome, Dr. Youngberg.
Good to be with you, Susan.
Well, thank you. All right, well, let's get right into it. So in our first session, we talked about steps you can take to fortify your immune system. So I encourage you to go back and watch that episode. Episode 2, we talked about the interrelationships between COVID-19, diabetes, and cognitive decline. In this session, we're going to focus on 3 important topics. The first one we know is top of mind with everybody is the vaccine. So we want to give some consideration to that and give you some things to think about as you think through that process. The second thing that has become prominent related to that is this idea of post-COVID syndrome. Dr. Youngberg is going to give us a lot of feedback on what that is and what people can do about it. And then finally, with it being January, we know we all need to focus on our 2021 health goals. And so he's going to give us some tips on that as well. So first of all, people are more aware more than ever that they must be proactive in protecting their health and the health of their family members. How to do this and how the vaccine fits into their health goals are important questions many are asking. And we thought it would be most helpful to highlight what the current facts are surrounding this topic and what some of the main considerations should be at each person as each person develops their health plan. We want to also review current strategies shown to be very effective in preventing and limiting symptoms from COVID-19. We'll also take a look at this post-COVID syndrome and how to combat it. And finally, those 2021 health goals. So with that, I'd like to kick us off with the first question, Dr. Youngberg, and that is whether or not people end up choosing to get the vaccine. Some are for it, some are against it, many are undecided. The truth is, many of us don't have the option to get it right now. So we're still in that waiting period. We're in line, so to speak. So who is currently prioritized by the CDC?
So yeah, it's it's been Operation Warp Speed was just amazing. That nobody really believed that a vaccine could actually be rolled out by December 2020, as it was. So it was an amazing partnership between government and the private sector. It's really literally amazing how that happened. Now, the bottom line is that there's not enough vaccines for everybody, and so the CDC had to basically come up with a prioritization list, and that they decided, there's a lot of debate about how that should have been done, but they decided that health care workers that were at high risk, that work directly with COVID patients, they should definitely be amongst the first vaccinated or given the option to be vaccinated. And of course, first responders, and of course, all those in the long-term care facilities. There was a lot of ethical discussions about that should be by far the first group, because that's where the majority of deaths have occurred from COVID-19 is in these long-term care facilities, these group homes with elderly that had many comorbid conditions. And it was just so sad to see how, our policymakers were really were really ineffective in protecting them early on in this pandemic. And of course, we should really be focusing all our intervention strategies on how we can protect those who are at greatest risk right now. So that's group 1A. There's actually 4 different priority groups. The group 1A is group 1 that we just mentioned. Then there's group 2 is group 1B. So it looks like everybody's kind of in the first group, but really it's going to be sometime before those who are above 75 years of age, okay, but are not in long-term care facilities, including essential workers that have high-risk exposure, childcare workers, teachers, school staff, government leaders, doctors, and primary care physicians. Those are group 1B. Now, they're actually starting to include those in some communities already, even though the very few of group 1A have fully been vaccinated, those who choose to be. So we'll talk about that a little bit. But and then group 1C, which is the third group, the third priority group, are those who are 65 to 74 years of age. And they're also includes public safety workers, police officers, low-risk health personnel that aren't directly dealing with COVID patients on a regular basis, essential workers at grocery stores, right? They're potentially being more exposed to this, public transit and postal workers. And then finally, the last group is the rest of us who are between age 16 and 65. Now, different municipalities and cities and states have taken different approaches using these guidelines. Some like New York City has gone as far to say they were going to prosecute hospitals that actually gave it to people other than those in the 1A group. And of course, the challenge is that because of the uncertainty of what's going on, many people in that group have chosen not to be vaccinated, and therefore there's the potential of these vaccines going to waste. And so many community leaders are opening up the option to individuals in other priority groups, even though the CDC hasn't really done that yet.
Well, Dr. Youngberg, it sounds like it might be many months before some of us can have a choice to be vaccinated. Could you elaborate on maybe some of the scams that could be going on, people making phone calls saying we could put you up higher on the priority list for a price?
Yes, that's such a critical thing. That it really saddened me when I started seeing news reports that elderly individuals or even middle-aged individuals are getting text messages, emails, or phone calls saying, hey, you've been upgraded on the list. We just need to get some information for you. Never give out your social security number, never give out personal information, never especially give out banking or financial information.
That's so important.
Yeah, the individuals that are officially responsible for contacting people, for tracing, contact tracing, etc. They would never give out information, names of other people that have been exposed or infected, and therefore that's how they associate you. They never give out names. They're following the guidelines, the HIPAA guidelines that protect privacy. So it's really critical to be aware that this is an opportunity for scammers to take your money, to get a hold of your bank account and take your money. So never give out personal or financial information if you're not sure, if it sounds like something is official, but they're asking you some things that you're not comfortable with. Get their name, get their phone number, get the agency that they're working for. And then rather than calling them back at the number they give you, call them back at the number that you get through the internet, officially looking up that agency, and then ask them for further guidance. But there are people being contacted right now that, hey, you can be moved up, but never at a price. It's free. Okay, it's free. Well, taxpayers are paying for it, right? But right now, you should not feel like you have to pay money to get the vaccination. Plus, in some areas, that would actually be illegal.
Very good. Well, as was mentioned, it's likely going to be many months before any of us have a chance to get the vaccine. So what are your thoughts as to what we should consider right now to protect our health?
Yeah, that's the key. If I've learned anything from my practice over this past year, is that the most important thing is to take care of your personal immune system. The best thing you can do for other people is to take care of your personal immune system. The best thing you can do for yourself is learn from your doctor, and there's a lot of educational materials online from expert physicians who have taken their time to explain what we can do at home on a personal level to protect us from ending up in the hospital. So, and we can look at some of those strategies a little bit later. But, let me tell you some of my personal experiences. My own older brother, about a week and a half ago, called me up, and I was getting texts from him during the day, and I was with patients. So I'm going like, well, he doesn't usually text me like that during the day. And then his wife was like texting me and trying to call me. And when I finished patients, I called him back, and turns out that he had tested positive for COVID with a rapid test. And, it came up within 10 minutes. It's the best way to get tested is, rapid testing. And so the first thing I asked him, I said, well, have you been doing the things that I recommended? I've been doing videos for a whole year now on what to do to protect yourself, to number one, limit your risk of getting infected in the first place. And number two, if you do get infected, limiting your risk of getting seriously ill, ending up in a hospital, or worse yet, dying from COVID. And so, this is very real disease that has serious complications, but there's many things that we can do right now to protect ourselves. So I said, have you been doing these? And he paused for a few seconds, and I knew what the answer was. No, we're busy. We're all so busy and under so much stress because of what's going on that it's easy to forget to do the most important things, the most fundamental things. Of course, we've at Brighten Heights Vitality Series already done several videos that are going to be listed in the description on the YouTube section of what they can click on those and watch those as well. They give a lot more details on this. But one of the first questions I asked my brother said, "Have you been taking vitamin D? At least that?" He goes like, "No, I haven't." And there's so much good evidence on how protective and therapeutic vitamin D is at appropriate doses, at the right doses. Most people taking vitamin D are taking far too little for it to be effective. It's like somebody who's dying of thirst, and you give them a thimble of water. Well, that's something that is of some benefit, but that's not going to solve the problem. That's not going to get them at risk of serious dehydration. So likewise with vitamin D, you got to take enough. And again, we'll talk about that in a little bit. But so I immediately got him started on some very therapeutic doses of vitamin D because I knew he was so deficient. We needed to fill up the well of vitamin D stores so that he could be making that antimicrobial peptide, that powerful chemical that is produced by the body's own immune system when exposed to vitamin D, called cathelicidin, which is the most powerful antitoxin that we know of to kill viruses and bacteria and other things that should not be in our body. So we got him going on that, and we'll talk about all the other things that we did in a minute. But within 36 hours, my brother was back. And he was high risk. He was, older than me, so he's in his mid 60s. He's overweight, and we're working on that now. And he had previously had lung cancer because of his work in construction. Had actually never smoked in his life, but he had lung, so he was high risk. So as a university professor, the university was on him, making sure he was seeing this doctor. Within 36 hours, this doctor says, "Wow, you're basically fine." He says, "What did you do?" So my brother shared all the things that he did, and doctor said, "Keep doing it because it's obviously you're far better off than I would have expected at this stage." Well, so there are things that can be done if we find out we are infected immediately to decrease our risk of requiring hospitalization or of ending up having what we call post-COVID syndrome, or this long hauler syndrome, which is bad news with neurologic symptoms and so forth that we'll touch on. So Dr.
Youngberg.
Yes.
Why don't you give us your summary of what your top tips are if you get infected by COVID?
Excellent. Thank you, Scott. Good question. So there's a short summary. By the way, I want to promote a video done by Professor Dr. Roger Schwelt. He's a professor of medicine at the University of California at Riverside and Loma Linda University, and he recently did a video called 10 Tips to Get COVID. I also did a video a few weeks ago that's called 21 Immune Balancing Tips. And we're going to have links to both of those in the description below once we get a chance to add that in after the presentation. But, he also did a powerful review of the medical literature presentation just on vitamin D. It was over an hour. And you can check this out at medcram.com or on YouTube. Just look for vitamin D. Dr. Roger Schwelt, who's a critical care physician who treats COVID patients and has from the very beginning, he's been recognized in the medical literature as to be the most respected COVID doctor in the world in terms of giving out the accurate and balanced information. He has been watched by over 5 million viewers. Just that one video alone, over 5 million views. Okay, wow. And I encourage you to watch that as well, because he does a very good job to lay out all the details, all the medical information that documents why everybody essentially should be on a therapeutic optimal dose of vitamin D. Now, that in my own experience, as we look at this list, I've had experience with close friends of mine who are doctors who lost their parents, or sometimes both parents, sometimes one of their parents to COVID, and then others who have not. What's the difference? Why are some elderly individuals in their 80s in particular, why are some of them so susceptible to COVID where others are not? And one of the answers, there's many answers to this, but one of the answers is how whether or not they've been taking advantage of this list of natural strategies, in particular vitamin D. So the last story, as I bring in this list of tips, is a friend of mine who is a robust, strong young man. Well, he's 10 years younger than me, so I call him young. He's basically 50 years old, and very strong and dominant on the basketball court, very healthy, and yet about a month ago, he almost died from COVID-19. He basically couldn't breathe. And if he hadn't been doing the minimal things that I'd recommended to him while we were playing basketball one day, he probably would have died. Okay, but he wasn't doing enough of the strategies, and so I actually took a whole bunch of stuff to him when I found out that he had been in the hospital and almost died, and we got him on the mend. But just last night, I called him up to see how he was doing a month after this all began, and he said to me, he says, you know, I've been thoughtfully thinking about all of the things that I could have done differently. He says, I almost died, and I want to make sure I don't make that mistake again. And he says, you know, the one thing, the one thing that really predisposed me that week that I got COVID is that I have been trying to avoid drinking alcohol for over a year now, he told me. But that week he decided, you know, he was stressed out, he was tired, he wanted to relax, he wanted to unwind. And so he had several drinks, 3 or 4 drinks actually. And he says, that was the tipping point for me. It was after that my immune system got depressed and I came down with COVID. Now, this is actually a common theme that I'm seeing in many of the people that I've talked to. I've talked to many college students that came down with some bad COVID symptoms for 3-4 days. I mean, they were knocked out. And almost in every case, they had been drinking a couple of nights, 3 or 4 nights before they found out that they had COVID. And so, or they'd been staying up way too late and under a lot of stress. So we gotta pay attention to these risk factors. Stay away from alcohol. You know, and the problem is that because of the stress of lockdowns, etc., people are resorting to drinking a lot more than they used to, which is one of the worst things you can do if you're trying to protect yourself from COVID. You're increasing your risk. So let's go over the short list real quickly. Bottom line is avoid sugar. You got to stay. Sugar depresses your immune system, and it also basically inactivates the activated form, the hormonal form of vitamin D in your blood. And so the very thing that's protecting you against viruses and against the inflammatory reactions that are bad for the brain, the heart, and so forth, and the lungs, and the cardiovascular system, is being inactivated when you eat sugar. So stay away from sugar. We already talked about alcohol as well. The other tip here, and this is what Dr. Roger Schwelt recommends, and I've been recommending it for over a year, is get a little pulse oximeter. Stick it on your finger and make sure that your oxygen saturation doesn't drop low. It shouldn't be below 94. But if it starts getting in the low 90s, or especially if it gets below 90, you're in trouble, and you gotta contact your doctor right away. My opinion is if you're under 94, you should start already being in contact with your healthcare providers, because you are not fully oxygenating your blood at that point. So get a little $20, $30 pulse oximeter. You can get those on Amazon or many different stores, and have it available. Every household should have one of those. Then if you are at high risk, consider talking to your doctor about using monoclonal antibodies. We haven't heard a lot about this, but there's good studies suggesting that if you're at high risk, you can take advantage of these to protect yourself ahead of time from succumbing to a bad infection. And then there's other things that I'm going to go through real quick that are outlined in detail in our previous videos and in Dr. Roger Schwelt's videos. N-acetylcysteine, powerful immune enhancer. Vitamin C, quercetin, zinc, vitamin K2, magnesium, vitamin A, appropriate use of iodine. All those things can be used appropriately to dramatically enhance our immune function against viruses and bacterial infections that can also cause pneumonia and lead to complications of COVID secondarily. We got the melatonin that can be used to improve sleep. You got to get your sleep, as we talked about. And then last two things to point out. The use of what we call hyperthermal therapies, or therapies that heat up the body. Remember, the fever is not something that should be avoided. The fever is the body's attempt to fix the problem. So don't just automatically start popping aspirin if you have a fever, okay? And it's only if your fever's super high that you should consider doing that. But having a fever like 101, you don't medicate a 101 fever, because that's actually the best way to activate your immune system. So optimize fever, okay, through natural methods like exercise if you're healthy, using sauna, using hot baths, hot showers, contrasted with cold. So there's whole videos on my website, dryoungberg.com. I have a whole 18-page protocol that can be looked at. It's free. It's available to anybody, that educates people about what the latest science has told us about how to optimize the immune system, and specifically how to do these hot, cold contrast showers or baths to turn on your innate immune system. And then finally, if you are sick and you're home, okay, then obviously isolate yourself. Don't infect your family members and your friends. Isolate yourself. And open the windows, let the fresh air come in. If it's cold out, and open the windows 3 or 4 times a day, long enough to ventilate the room, and then close them again. Spend time in the sun, whether it's in your backyard or whether it's on a porch or sitting near a window. Spend time in the sun powerfully helps improve the immune system, and if needed, get a portable HEPA filter system. So those are kind of the quick list of things that we can do to protect ourselves, and the best things that we can do to protect other people around us. Because if we're healthy, that means we're not transmitting the virus to others.
Thank you.
Very good. Well, so Dr. Youngberg, we've heard a lot on the news lately that anywhere from 50 to 60% of healthcare workers are refusing to take the vaccine. And my question is, who are these healthcare workers? Is it doctors? Is it nurses? Is it aides? And then what is their rationale for not taking the vaccine? Do you know?
Yeah, well, one of the things here is that I just recently, a couple of days ago, I had a talk with one of the most respected family physicians in our community here in Southern California. And he said, young doctors, young doctors that are, under 40, he said they essentially have zero chance of getting seriously ill or die from COVID. Now, we don't like to use the term zero too often, but essentially it's negligible risk. The risk is so low. It's like you're more likely to die in a car accident, than you are of COVID, right? If you're fairly young, if you're a young adult. So there's then they're looking at, why should I take the vaccine right now? Okay, my job is to keep myself healthy, and by doing so, I'm protecting other people as well. Now, of course, there could be other reasons why young adults would take the vaccine, depending on other medical conditions or underlying conditions. There was one physician who was in his early 70s, who was otherwise healthy, came down with COVID, almost died from it. This is at the beginning of the pandemic. And we're asking, well, what were his risk factors? He didn't have the traditional risk factors. Why did he get so sick? Well, it was months later that he discovered that he actually had a cancer growing. He had non-Hodgkin's lymphoma growing inside of his body, and that's what had depressed his immune system, right? So that's why it's important for all of us to have appropriate medical checkups and not avoid working and having doctor's appointments right now, because that's what keeps you healthy, right? Don't wait to go to the doctor until you're sick. Go to the doctor to stay healthy and robustly so. So, the reason a lot of people are choosing right now to not take the vaccine, or at least postpone it, is because new therapies with limited research and observation time make people a little insecure, understandably. So it's one of the largest family practice medical groups that I worked with in the past 30 years, had what they called the Dr. Bucher rule. This was one of their elderly statesmen, physicians in their practice that had been there for 30 years. And they had learned from experience to be very careful to rarely prescribe medications unless they had been available to the public and they had been prescribed by other doctors for the last year. And it's only after about a year of experience with a new medication that you start to understand its true risk factors and what can happen and what the real contraindications are, who should not be getting it and who should be getting it. And so now that's hard to do with this type of vaccination, right? Because of the pandemic and so forth. But it is an important comment as to how we should be very careful, not just jumping in with both feet in new therapies, and unless the benefit far outweighs any risk, right? So that's one thing. And then we need to be just honest with the community, that for when a medication receives emergency use authorization, right? It wouldn't need emergency use authorization if it had been fully tested for safety and efficacy based on normal standards, right? And so just by definition that these newer vaccines have emergency use authorization means that we don't know as much about the potential side effects of this as we would of other vaccines, for instance. Okay, and so another example of this is just a few days ago, I looked at the discussions being put out by Maryland, the state of Maryland's Health Facility Association, and the leaders in this organization were saying that about 55%, this is in Maryland, of the nursing home and long-term care workers had agreed to be vaccinated. And then they quoted this in their document: the rest simply don't want to be first, end quote. It's understandable. And so, they have an ethical right to say, I want to wait. Okay, give it to somebody else who wants it, who feels more comfortable with it right now. But don't mandate don't force me to take something that I'm not comfortable doing yet. Okay, so they also, and I quote in their article, they said they are reluctant to get vaccinated, citing history of mistrust of the medical community. Now, I don't know the background of that in that area, that county of Maryland, but there's certain populations, especially certain populations that because of historical issues are a little bit more cautious with jumping into new therapies. And ultimately, that what they discovered is that they reported that only 4.3% of the available vaccines to them had been used. Wow. Now, hopefully that's changing, right? Because those who are ready to get vaccinated, they should get access to it and have appropriate access. And that's starting to change even in the last few days. But as of January 6th, in Maryland, only 1/2 of those in Group 1A, those that have been prioritized for vaccination, have been vaccinated. And then And then in Virginia, only 1/3. And in District of Columbia, 1 out of 5. Okay, only 20% have got. So it's a real problem, in that we need to be very, very transparent with informed consent to let people know exactly what we know and what we don't know. Okay, we don't want to act like, that there's absolutely no risk, because that's not true. There's always some risk, and especially for some people. So that's kind of the summary of why some people are choosing not to. Yeah.
Okay. Well, another question we have is we've heard a lot about herd immunity. Can you explain what that is and how it can be accomplished?
Okay, so basically, herd immunity is referred to as the number in a population already protected from the virus that's needed to decrease the spread of the virus to less than 1-to-1. In other words, there's a concept in medicine or in epidemiology called R0, or the reproductive number. That is the number of, if I get infected with the virus, okay, how many other people are going to be infected by me just simply because I'm infected? That's the reproduction number, or the R0. And right now in COVID-19, it is estimated that the R0, the reproduction number, is around 2.5 to 3, meaning that at the most right now, for every one person who gets infected with COVID-19, another 3 people will get infected. And so that's the argument. That's the theory behind the lockdowns, etc. And what I've been advocating for is to be real aggressive about protecting those at the highest risk, right? Because that's the whole point. The whole point is not how many people get infected, but will the high risk people get infected? They're the ones that are ending up in the hospital. And so we need to do a better job of stratifying the population and making sure that group is being educated fully as to everything that they can do to be more protected than they currently are. So some researchers it's debatable right now. We just simply don't know what percent of the population needs to be protected or immune in that sense before herd immunity occurs. And some are estimating around 50% would need to be protected or immune already. Some say no, it's up to 90%. Now, many advocates of herd immunity are referring to how many people would need to be immunized before herd immunity actually occurs. And the bottom line here is that it's important to note that immunization is not the only way to be protected. For instance, okay, I mean, it is a way to be potentially protected based on the preliminary research. Okay, but the preliminary research from the 2 mRNA vaccines available right now, Pfizer and Moderna, their research, they only really discussed how many people were protected from symptomatic or serious infection. They did not, at least I haven't been able to find the data on how many of the placebo group or the treatment group who received the vaccine actually tested positive with the PCR test that we're using to determine whether somebody is potentially infectious. And so we need to make sure that we're using the same standard that we use for determining, whether somebody needs to go on, be quarantined. We're using the same standard for evaluating the vaccine as well. And I haven't seen that done yet. So I'm really looking forward to seeing that data because they're actually saying that there's no evidence that the vaccine actually prevents you from being infected, which of course it's the whole argument for herd immunity is that you can't be, if you're infected, you're going to be potentially infecting other people. That's why people who get the vaccine are still being told you got to wear a mask and you got to social distance. So it doesn't change anything about our other behaviors, okay, other than that we should be protecting our immune system with natural methods that we already pointed out. So number one is a lot of people have already been infected. So you already have a significant percentage of the population that has protection and has immunity. And the good news from studies just being published, a study published in the Journal of Infectious Disease just January 6th, basically pointed out, and I'm going to read this specifically because this is really good. They pointed out that of those that had been previously infected, this is in the United Kingdom, of healthcare workers that had been previously infected like 6-7 months ago, none of them have been reinfected symptomatically. None of them.
Dr. Youngberg, I was going to ask that question. If I've been previously infected, how long does the immunity last?
Yeah. So right now, the CDC guidelines suggest that, if you've been previously infected, that you can postpone the vaccine for about 3 months or more, that you don't really need the vaccine right away because you have immunity, right? And now for the latest studies coming out are suggesting that immunity is actually long-term, that would be extremely rare for somebody to get reinfected. They would have to be somebody that is immunocompromised in a significant way. I believe that I've only seen 4 cases reported so far of reinfection. So it's extremely rare reinfection. And in this population of over 1,000 healthcare workers that had been previously infected, 0 of them were reinfected after the initial infection within 6 to 7 months. So we also have data from the original SARS-CoV-1 virus that hit the world in 2002, 2003. Of those who were infected with that, they still have immunity 18, 19 years later. So we have more and more evidence coming out suggesting that the benefit of being previously infected is more long-term. And that would suggest as well that the benefits of the vaccine would also be potentially more long-term. So it goes both ways. So the other thing to be aware of is that in addition to the fact that many of us have already been infected, don't even know it because we had a healthy immune system. And so now we've developed both antibody immunity and what we would call innate immune system or T-cell immunity. A study recently published looked at individuals that had their blood drawn in 2015, way before this pandemic, and they were tested for T-cell immune system, T-cell immunity to COVID-19. Guess what? 30 to 60% of those blood samples showed that they had a powerful immunity to COVID-19. So all these things suggest that if we pay attention to all these strategies, including the natural strategies that we've been emphasizing all along, that we're much further along in protecting other people than we currently than more recently we thought we were.
Now, I'm going to perhaps throw a curveball, but I just heard this from my daughter the other night, and I've never heard this before. She said, well, supposedly if you have type O blood type, you're less likely to get infected or have symptoms or something. And I said, well, that's great. I have type O negative, But is that true? Have you heard anything like that about blood type having impact?
I haven't really looked into that data carefully. I've definitely seen the reports.
Okay.
I don't know how powerful that immunity is. My hunch is that I would not bank on that. Okay,
Yeah,
I would bank on the things we've been talking about are much more powerful predictors. In other words, if you eat a fast food diet and a lot of sugary foods, if you drink alcohol, etc. Those things are far more greater indicators of risk than your blood type, I would think at this time.
Right. All right. Well, let's go on to the next question. That is, how should someone evaluate whether they should take the vaccine? You know, like, are there other, you know, like health issues? You know,
right. Yeah, that's a very fair question. And, you know, everybody's contemplating that, you know, and first we should say that this is always the decision between the individual and their personal healthcare professional, their personal physician or primary care doctor. Because it's your doctor understands your risk factors better than anybody. Okay. And, you know, I always say that we should be the chairman or the chairwoman of the board of our health. Okay. And that means we should understand our risk factors the best, but take advantage of the expertise of our healthcare team to help us understand what that means and what we can do about it. So definitely discuss that with your doctor, because that's ultimately the simple answer to the question. Now, here's some other considerations to actually contemplate as you prepare to discuss this with your personal healthcare team. First of all, primarily we do this by assessing our personal risk and the other options that are available to us to optimize your immunity. I'm just kind of reframing or rephrasing what we've already said several times, is that we need to understand what puts us at risk, right? And then do something about it. Don't just wait. You know, we should definitely, whether we choose to get the vaccine or not, we shouldn't be looking at the vaccine as the final solution. It's not. Nobody's saying it's the final solution. That's why they're saying you still got to wear a mask, even if you get that second dose of the vaccine. You still got to social distance. It's not a final solution. It's just one potential piece of the puzzle. So here's a couple case scenarios to consider. For example, if you are elderly, you know that your immune system's not so hot. Okay, you have underlying medical conditions like heart disease, hypertension, diabetes, lung problems, kidney disease, et cetera, et cetera. You've never been one to be really that motivated about taking care of your health. You do some stuff that's good, but you just live a life like everybody else, and you hope things will work out. So you're not on particularly a great diet or a good exercise program, and you're not following the strategies that I outlined before. Well, chances are you would be at the highest benefit risk ratio of getting the vaccine. In other words, because you're not doing other things to protect your health, okay, and you're at high risk, then assuming that we are very hopeful that the side effects of this or the long-term potential complications of these vaccines are limited, right? And that's what we're hoping, we're banking on that. But you're going to be in the group that have the most to gain from potentially choosing to take the vaccine. On the other hand, if you're young, you're health conscious, you have regular health screenings, you know what your health is. You're not just assuming you're healthy. You know you're healthy because you've been evaluated fairly broadly and appropriately, and you've been taking your vitamin D. You have you've measured your vitamin D, and your vitamin D levels above 50 nanograms per deciliter per milliliter. You're doing the hydrotherapy. You're doing the hot showers. You're doing all the things that maximize your immune system. You've checked your copper zinc levels, and you're optimizing your zinc status, because almost all my patients are low in zinc. Almost all of them. Now, admittedly, I'm working with patients that are higher risk, right? And so I'm helping them figure this out. I have not had one patient die of COVID this entire year. Not one. Okay, that has been working with me and that has been applying even some of the strategies I recommend. And I mainly work with elderly people who have multiple comorbidities. Okay, so that should tell us something, is that the choices we make represent the biggest impact on our risk. So those would be the two extreme case examples. And then I will reiterate what one of our most highly respected physicians in the community here in Southern California said to me a few days ago. He said, if you're a young person and healthy, you have no risk. Okay, and so the key is stay healthy. Don't go out on a drinking binge. Don't do unhealthy things that increase your risk of being infected, which then could lead to infecting other people. So we do have that responsibility to protect ourselves, and by doing so, we're actually protecting other people as well.
Now, Dr. Youngberg, I just want to point out to our panel here that we're getting close to time. We want to keep time for questions, and we also want to get to goals for 2021. But are there reported contraindicators that people should, or reasons that people should seek guidance from their healthcare providers surrounding the vaccination?
Okay, so let me just go through this real quick. First of all, if you have a serious allergic reaction to the first dose, common sense would say, don't get the second dose, right? So obviously You're working with your doctor on that to make sure that that's the right decision. But that's the CDC guideline. Secondly, if you have a known allergy to the polyethylene glycol, this is the fat, the nano fat particle that is surrounding the messenger RNA protein that allows it to get into your body without it being broken down first, and then allows it to do the job that's intended to do, to produce the spike proteins that then initiate the immune response and help protect, build immunity. So if you're allergic to that, obviously don't take it, right? If you are allergic to polysorbate, which is a stabilizer in many medicines, then don't get the vaccine. There's other vaccines coming along the pike that are not going to have this, that are not messenger RNA vaccines, that would not be a contraindicated situation for them. Also, excuse me, if you've had another vaccine of any type within the last 2 weeks, postpone. Do not rush and get this vaccine just because it's available, because when you do multiple vaccines, one on top of another, it increases risk for complications and side effects and possible autoimmune reactions. So don't, for instance, the MMR vaccine says wait at least 4 weeks between that vaccine and other vaccines. Okay, and if somebody were to ask me and say, I'm going to get this vaccine, how long should I wait after getting other vaccines? I would say wait a month. Okay, and then in the meantime, obviously take care of your health, right? So if you have a serious food allergy, the CDC has reported you can proceed, okay, but with the vaccine, but stick around the vaccination, the clinic for at least 30 minutes to make sure you don't have a bad allergic reaction. So you can be treated right away if you do. Okay, now if you have a moderate or severe acute illness, hold off, postpone. Okay, because your body's not going to do a good job at developing antibodies against with the vaccine if you're sick, right? And so obviously in that situation you want to have a significant discussion with your doctor. If you're really stressed out, that can also greatly limit the potential benefit of any vaccine. So go in, if you're going to do it, go in with a positive attitude. If you're not going to do it, also don't do it with a positive attitude, because if you have a negative attitude, either way, it's bad for your immune system. Okay, and those who've been infected, PCR positive tested in the last 3 months, postpone, right? You're immune, right? Essentially, and so there's no reason to rush into it. You can wait, and potentially that immunity is more long-lived as well. Now, this raises a question that Dr. Paul Otif, who's one of the top advisors for the FDA advisory panel on vaccines. He's a vaccinologist, immunologist, and I read a very interesting interview with him some time ago, and he raised this question that one of the potential problems is that you can get what's called antibody dependent enhancement. That means that when you get this is what we found with the SARS-CoV-1 vaccinations that ended up not being used because of this, is that they found that in animal studies, those who had received the vaccine did well, they received immunity, but later on when they were reinfected with the actual virus, the antibodies actually increased the entrance of the virus into the cell, and it made them sicker and more likely to die. So that's a question that we all have here, and that's Dr. Paul Offit basically raised that issue several months ago, and we're hoping that that's not the case with these vaccines, but we don't know yet. Okay, so and if you've been exposed in the last week but not sure, then remember the incubation time is 4 to 5 days. So you wait at least a week if you think you've been exposed. If you start getting symptoms, then you don't get the vaccination. You wait until you've gone through that, because you essentially have already been vaccinated with the real thing, right? Additional considerations is make sure you're taking all the supplements that we talked about. And if you have a personal or family history of autoimmune disease, then you really got to discuss that with your doctor or an allergist specifically, because there have been some very rare reports. Just last week, there was a physician, 56-year-old physician in good health in Miami Beach, Florida, at the Mount Sinai Medical Center, who got the vaccine. 3 days later, he started seeing blood spots on his legs, little red spots on his legs. They had blood testing to found that he had autoimmune thrombocytopenia, which is where the platelets are being damaged by the immune system, and his platelet count went way down. He ended up dying of a hemorrhagic stroke because he bled out. Okay, now that's extremely rare, obviously. It's the only one I've heard of so far. And there have been millions of vaccines already given. So we can't use that as the one reason why we're not going to do it. But we need to understand our risk factors, not just if we're just simply, we think we're healthy, but we haven't been checked out, then we may be in error there.
Hey, Dr. Youngberg, we actually have
chemotherapy or on chemotherapy, probably not a good idea right now based on CDC guidelines. Again, work with your doctor to make sure that you're doing this right.
Dr. Youngberg, to tag on to that, we do have a question from one of the attendees. She says, what should be included in my blood test to show how well my immune system is doing?
Wow. Okay.
Well, hold on. She says, I'm 70. So, for example, vitamins, minerals, T cells, interferon.
Yeah. So, I mean, that's that would take another hour to discuss. I mean, that's what I do with patients, right? Is do that, and that's not a simple thing. But at minimum, get your 25 hydroxy vitamin D level done. That's the activated form of vitamin D, the storage form of vitamin D in the blood that can really protect you against viruses and bacteria, etc. So that'd be minimum. Get that. I would also, get the standard tests, the CBC and the comprehensive metabolic assessment. I think that gives the ideas of what's going on in your health. I like to look at the copper zinc ratios. I like to look at the ceruloplasmin level, which is the transport protein for copper. I find that a lot of my patients have excess copper, but many of them have excess free copper, even though their copper levels are normal, meaning that even with normal blood level of copper, that is the serum level of copper, they actually have high free copper because their ceruloplasmin transporter for copper is too low. And so I look at all three of those tests and others to help advise people. That's one reason, by the way, that most people right now should be taking about 30 milligrams of zinc on a daily basis until we get through this pandemic. And again, work with your doctor to check other labs that are appropriate for you as well.
Thank you. Well, we are truly out of time, so I'm thinking we're just going to have to tack on to our next webinar in February, a discussion about the post-COVID syndrome. But I do, since it is January and we really do want to get people off on the right foot, let's just take a moment and talk about 2021 goal setting for just a moment. And I know you have some tips for that if you just want to toss those out there, Dr. Youngberg.
Yeah, okay. So, we've actually already done it. My main tip is go to your doctor and get tested. Do extensive labs. Don't just get the standard labs, and look at the labs that tell you more information than you already know, right? So that's one thing. The best wake-up call to improve your health is do tests that you've not done before and become aware of something that is a risk factor that now you gotta do something about. So I always find that when I do extended testing on myself or my patients, it raises the level of consciousness, it raises our motivation level, because now we've seen something that's come out of our own body that's telling us, hey, time to get busy because this is not too healthy here. And our goal should be to find new risk factors, not to ignore old risk factors. Right? The more we know about our health, the better chance we have of protecting ourselves and the ones that we love. The other thing that I would recommend, and I can put we can put some links to this effect in the description below on the YouTube section, and that is, get involved with a family member for an exercise program. Find somebody where you can make each other accountable on your diet, on your exercise, somebody that you can talk to, not to make you feel bad about the mistakes you made. We all make mistakes from time to time, but somebody that can encourage you, like, hey, you can do it. So coming together, even if you need to do it virtually. And in fact, that is a great idea as well, is join a Zoom support group. We're doing this monthly right here. You've joined this group. That can keep us focused, but maybe join a weekly Zoom program that is designed to improve your health, or some type of support group, because we all need encouragement of others, don't we?
Right. Well, and let me just toss out what I did, and I found that this really helps me, is anytime I write down an actual goal, which I confess is not very often that I do it, but I did that for this year because I'm turning 60 in September. And so I wrote down my 3 health goals. And, when you're young, you focus on, I want to lose weight and look good in clothes. But when you're older, it's, no, I just want to make it, to an old age healthfully and enjoy those golden years. So I made specific goals regarding that, like getting rid of inflammation and things like that. So I would just encourage everybody to also just write down some goals. You don't even have to show them to anybody. But just the fact that you wrote them down and you looked at them and they're kind of emblazoned in your mind, I think will help you be motivated to actually make it happen and think about ways to make it happen. Well, that's all the time we have. I know we've run a little bit over. I do want to tell you that our next webinar is going to be on Monday, February 15th at 4 p.m. The topic's going to be 2 simple exercises to jumpstart your health. And I just want to say the next several webinars are really going to be drilling down on specific strategies for health. And so stay tuned for that, because we will talk about at some point lab testing and supplementation as well. Thank you for your time and have a great week. Bye-bye.
Bye-bye, everybody.
Bye-bye.